You thought breastfeeding would feel natural, but no one told you it could feel confusing, painful, even lonely. As a pediatrician and a parent, let me say this upfront. Breastfeeding is natural, but it doesn't always come naturally. I've worked with hundreds of moms, and almost every single one had questions, doubts, and hard days and nights. In this video, I, Dr. Abhinav Malhotra, your friendly pediatrician, am sharing 5 gentle, practical breastfeeding tips I give every new mom, including the one trick that can instantly improve latch in 10 seconds. And at the end, I'll tell you the one thing that every mom must know, the thing that makes all the difference. Before we had a baby, my wife and I thought breastfeeding looked so calm. The soft music, baby smiling, and mom glowing. Well, when it was time for my wife's first latch to feed our baby, I remember suddenly she needed 3 pillows, a breast pump, a lactation consultant, and a pep talk from her mom. There was one night, day 4, post-delivery, she sat on the couch crying harder than our baby. Her nipples were sore, her back hurt, and she was convinced she didn't have enough milk. But just a few adjustments from her in-house pediatrician changed everything. And that's what I want to share with you today. The 5 breastfeeding tips. The first tip is start within the first hour of birth. It doesn't matter if you had a C-section or a normal labor. Breastfeeding in the golden hour, that is, the first 60 minutes after birth, can improve latch success, milk production, and bonding. Skin-to-skin contact isn't just emotional, it's biologically magical. As a pediatrician, let me tell you that this can actually lower the risks of hypoglycemia, hypothermia, and infections in your newborn. The second tip is that you set up your own space first. Breastfeeding isn't just about baby, it's about your comfort as well. Use a chair with a good back and arm support, or sit on a bed with full back support. Stack pillows under arms and behind your back. Keep water and snacks nearby. Hydration is everything. The third tip is you position properly. Everyone talks about positions, the cradle hold, the football hold, etc., etc. But trust me, latch matters more than posture. Bring your baby to you, not the other way around. Bring the baby's nose to the nipple, chin touching the breast. Wait for a wide open mouth like a yawn for latching, and then ensure a good latch. A good latch means the baby's mouth covers more of the areola, not just the nipple. You shouldn't hear those clicking sounds and feel pain. Don't ever do the nipple only feeding. Aim for a deep latch. Tip number 4. Follow the baby's lead, not the clock. Newborns feed every 8 to 12 times in 24 hours. That's like every 1.5 to 3 hours. And yes, cluster feeding is normal. Look for early hunger cues like rooting, lip smacking, and hand to mouth. Don't wait for crying. That's a late sign. Every baby is different. Trust your rhythm. Also, don't stress about foremilk versus hindmilk. Just let your baby finish the first breast before switching to the other breast. Trust your body. It knows what it's doing. Did you know that mother's milk gradually fattens during a feed? Forcing a switch too early can lead to gassiness or green stools. The mothers who breastfeed know what I am talking about when I say take care of your nipples. Survival of nipple soreness is extremely important, as nipple soreness is common in the first few days, but later pain that makes you wince, ouch, that's a sign of a shallow latch or damage. Latch properly, and remember, always air dry your nipples after every feed. Use breast milk as a natural moisturizer after feeding. Some people use lanolin creams as well if permitted. Alternate between your breasts to avoid one-sided soreness. Break the latch gently with your finger in your baby's mouth, and don't just pull away a sucking baby from your breast. Wash your breast with warm water after every feed, not soap, because that will dry the natural moisturizer from your skin. Avoid breast engorgement by using a pump or just manually with your hands and hot fomentation. Else, this only makes latching more difficult and gives more trauma to your nipples. Ask your pediatrician to check for a tongue tie if things are still not improving. And here comes tip number 5, the magic sandwich hold. For a better latch, this is my go-to trick in the clinic and the hospital for difficult latching babies. How to do the magic sandwich hold? Use your own hand to support your breast. Place your thumb on top of your breast. Place your fingers underneath it in a C-shaped pattern, like holding a sandwich. Thumb on one side and fingers on the other. Align the sandwich with your baby's mouth. Compress your breast in the direction of the baby's mouth, opening, not across it. See, at this moment, your baby's mouth is horizontal, so you compress your breast horizontally. Bring your baby to the breast, not the breast to your baby. Wait for a wide open mouth like a yawn or a fish mouth. Quickly bring your baby onto the breast, aiming the nipple towards the roof of the mouth. Release your hold gently. Once your baby is latched and sucking, if your baby has a deep latch, lips flanged out like a fish, and rhythmic sucking, you're good to go. The benefits of the magic sandwich hold are that it helps your baby get more breast tissue like the nipple and the areola into the mouth, not just the nipple. It also promotes a deep, pain-free latch. It's useful for flat nipples, engorged breasts, or newborns with small mouths. Most of all, it prevents nipple pain, shallow latch, and frequent slipping off. Now that you have it all figured out, believe in yourself and start. It's not tough anymore, and if you don't get it in the first attempt, calm down. Take a deep breath and try again. If breastfeeding feels hard, it's not because you're doing it wrong. It's just because it's new for both of you. You and your baby are both learning together. Every feed isn't just nutrition, it's bonding, it's trust, it's two hearts syncing to the same rhythm. So on the days you feel sore, tired, or unsure, remember, you're not failing. You're feeding with love. You've got this, Mama, and I'm here for every step. If this helped you feel calmer and more confident, hit like, subscribe, and drop a heart in the comments so I know you're here and I'm with you. And keep following for the next part of the video.